So this beautiful patient in her mid-50s has such a profound surgical result. It's so fun. So the before and after, when you compare them side by side, it's a really profound difference. But I have other patients that are actually friends with her that don't really notice. It was one of those things where they're like, God, she looks so good. She looks so refreshed. Has she lost weight? Did you do something with your skin? They're not asking her who her surgeon is. And that is key. If somebody's asking who your surgeon is, that means there's signs that you've had obvious surgery, which in my opinion leads towards bad plastic surgery. We want you looking refreshed, youthful, and natural. And this patient doesn't. So you can see here in her before pictures, her eyes were really heavy. She has these beautiful, beautiful eyes, and the hooding from the upper lids, the puffiness from the lower lids really contributed to her looking tired and fatigued. She had loss of volume in her mid-face, which was contributing to the nasolabial fold. She had jowling. She had fullness in the submental region where she felt like she just never had a good jawline her whole life, and it made her look heavier than she was, but when aging crept in, the laxity really started to show. That's really evident in this side profile. You can see where she has the fullness here in the submental region and how we have that nice, crisp, defined jawline here. The key to that is just a structural neck lift. That's where we make a little incision underneath the chin here. We elevate the platysma muscle, which means we're accessing stuff that you can't access through liposuction. We're addressing fat there, we're addressing glands, we're addressing muscles, and that's really gonna sculpt out this area to help give you that nice, defined jawline. You can also see that with her, we have added volume in the mid-face. The way that that happens is by getting a good deep plane lift. We did subtle amounts of fat grafting, but that's mostly done to help with healing and not to add significant amount of volume. So here with the up close before and after of her eyes, you can see that she has what's called brow ptosis, where her brows are heavy and hanging too low. She has significant extra skin on her upper eyelids, and then she has puffiness underneath her lower eyelids and texture changes. So with her, we did an endoscopic brow lift. So we raised the medial and lateral portions of her brow through tiny little incisions in her hairline. We did a upper lid blepharoplasty, which is where we remove the excess skin. By pairing that with the brow lift, we're able to keep the incision in that natural supratarsal crease and get rid of all the excess skin that's there and really open up. She has these beautiful, nice green eyes that you can barely even see in the before picture because they're shadowed due to all the heaviness and the laxity of the skin up there. And afterwards, we have this beautiful light reflex because we can actually see in there because we've gotten rid of all of the coverings. For her lower lids, what I did was remove some of the fat that was there, repositioned a little bit, and remove some excess skin through an open lower lid blepharoplasty. It's really fun for me to not only talk about the eyes, the mid-face, the neck, but to see patients do these dynamic movements